Shelter program. How do we go ahead and address this in a shelter program? Well, you'll see here, guys, it's pretty much the same that we use in a practice environment or a home environment, right? We just have to be creative about how we apply it. So here are some things, and I'm very interested in other people's suggestions, but this is how we've typically done it, where I've worked, is we have an intake questionnaire. So this is kind of like my behavior history questionnaire, right? And what we're doing with the intake questionnaire is we're trying to get a history on those cats. So if they have an issue with litter boxes, but have an understanding of, okay, were their litter boxes scooped once a week? And again, doing this and even if we're lucky enough to actually do an intake interview, doing it in a non-confrontational way. That you're asking these questions not to accuse them, but to help with your placement and management of that cat. All right? But that's the whole idea behind it, is that, and there's an example of one that the Animal Rescue League of Boston uses that I think is a decent one, but it's available online. But it's a really good screening tool. And then we have to observe their enclosure behavior. Now here's the negative, you guys. Oftentimes they don't show the problem at the shelter. Okay, they may have an appropriate urinator and they don't have a problem. And the reason I think that is my theory, and there's no studies that have been done on this, but my theory is that usually they're more confined. And when they're more confined, they're more likely to use their litter box. So that would be if you had individual cages. Okay. So you have to be aware that just because they're not doing the shelter doesn't mean that they couldn't do it at a home environment. That's why going ahead and placement is so important, and we'll get to that in a minute here. Okay. Same thing, principles apply. Same minimum databases. Physical exam, check neuter status, urinalysis. And then as far as treatment is concerned, just like everything, right, guys? Foster care is the best, if at all possible. Try to get them in a foster environment. And then typically what we recommend is having them monitoring their elimination, where it's done, what time of the day, what the issue is. And then, if after, they follow the standard cleaning recommendations, scooping every day, scoopable litter, bigger litter box, all those kind of things. And then after 2 weeks, if the cat is using the litter box in a defined area, then what we do is say, okay, after that period, continue to monitor, but we'll gradually expose them to the rest of the household. Key here, you guys, is gradual. The biggest mistake I see people make over and over again is that we give cats too much access to too much territory all at once. And it's too hard for them in most cases. So foster care is best. If that's not an option in a shelter environment, what we try to do is create a real-life situation. It's kind of hard to see this, but this is what we considered the real room in one of the enclosures that we had previously. Or a large condo or something like that, trying to replicate that environment as much as possible. And then the same things, we just monitor for inappropriate elimination. The hardest part in these kind of situations is that you may have multiple cats, so you don't know where it's coming from specific. So you have to adjust for that as well. And then the same environmental and cleaning recommendations. All right. So the one thing just to remember is just, again, just because a cat doesn't do it at the shelter environment doesn't mean they won't do it at home. But the good news is in most cases, it can be resolved. Like I said, in practice, I love these cases. I've been doing, just behavior for 11 years now, and I was trying to think of a cat that we weren't able to help. I think there's probably 2 that I can think of offhand, that I'm aware of anyways. And I just think it's a very, very, very treatable condition. All right. So the last couple of things here is placement. Obviously it'd be better if they went to a single cat household, but most importantly, is that they have an adopter who's willing to follow the recommendations that you give them. It's very hard to find those 2 things, because usually people that are willing to follow the recommendations are ones that have more than one cat. Okay, so but that's the key. Is you guys, it's education, education, education. If you just can make potential adopters aware of these things, we can prevent them from ever coming back or having problems at all in the future. And like I said, I'm in the business to get myself out of business. Full disclosure, regarding the cat's history. And then you could do a foster to adopt program. If it didn't work out, they could come back. Sometimes that's easy. But again, education, education, education.